It's quicker and faster.
Pay for anything online and take control of all your payment transactions with CalPay on the CalBank app. Visit the Play Store or the App Store and download the CalBank app to make bank and mobile transfers, request a checkbook, stop a check, and also have access to the CalPay payment platform. CalBank app. Forget to cash.
What does extra mean to you?
Extra means Tower data.
More minutes to talk to my loved ones.
Data that doesn't expire.
More talk time at the best rate. You want extra? Airtel Tigo is giving you extra. Extra data on Big Time Extra that doesn't expire. Extra minutes on Fuse Extra that doesn't expire. And extra unlimited calls. It's time for extra. Even our bonus data doesn't expire. You need fill up? Simply dial *111# to activate now.
Airtel Tigo. Life is simple.
In a world where everything is changing around you, sometimes you need to turn to someone you can trust. You want to move with a change in safe hands, and we are here to help. At Societe Generale Ghana, we understand change because we have transformed and evolved. No matter how our name may change, 43 years of retail and corporate banking expertise never changes, ensuring stability and trust. Digital innovation as the world moves forward to help you adapt, upgrade, and keep up. Bank with Societe Generale Ghana and enjoy doing your banking your way, whenever you choose. In our digital zone with cutting-edge digital banking products and quality services, you deserve a better bank and great rewards. We agree, the world only moves because you make it move. SG Ghana, the future is you.
There is one deadly disease in Africa, malaria, caused by mosquitoes. It has no respect for humans, and its symptoms are fever, headache, cold, cough, and vomiting. Malaria kills, so protect yourself and your family. If you have been diagnosed of malaria, the medicine you need is Malatu. Malatu is a good anti-malaria drug. It contains artemether-lumefantrine that gives you relief from malaria. Available in suspension for kids and tablets for adults. If it's malaria, then your solution is Malatu. And if symptoms persist after 3 days, consult your physician. For bulk purchases, contact NS Chemist. NS Chemist, providing quality and affordable medicine.
You graduate, next thing is some scholarship for your next level.
That be long thing. Today bring this, next day bring that. Koha, braha. You know I can't stand that. But everything is fast. I can't even wait for food. That's why I'm always eating Indomie. No long thing.
It's not the case anymore. Everything is digital now. Simply visit scholarshipgh.com to apply for a scholarship from the Scholarship Secretariat.
I can apply on there.
Fast.
Submit all my documents.
Fast.
Like my Indomie.
Just visit scholarshipsgh.com from 1st April 2020 and you could be on your way to your dream school. Chale, there's a faster and more reliable way to do mobile money. G-Money. JCB Bank's mobile money service gives you the freedom to send and receive money at the lowest rate from any mobile network just by dialing *422#. Check. The best part is you don't need to be a JCB customer to enjoy secure transactions with Ghana's safest bank and the widest branch network. Visit your nearest JCB branch or any branded G-Money agent with a valid national ID to register now. G-Money. Papa number. Chatum.
Accidents do happen. It could be a motor accident, a sudden heart attack, or even a stroke, or any other health emergency. The first steps you take are very critical. Should you be involved in or witness an accident, call 112 for the fastest ambulance response. With over 300 well-equipped ambulances all over Ghana, you are assured of the fastest response to your emergency call. Call 112 during critical health emergencies and save your life and that of your family and loved ones. 112, help will come. 112, we are safe. Avoid prank calls as they can lead to loss of life of persons in actual need of help. Be a responsible citizen.
19 minutes to 9 a.m. on the Super Morning Show on Joy997 FM. Remember, at 9 a.m. we'll take you to the Ministry of Information. There's a press briefing today where the minister, among others, will be addressing the energy subsidy. will be giving us an update on the work that is being done in the fight against COVID-19. Before that, though, our guest in studio is Dr. Samuel Kaba Akoria. He is in charge of testing centers. A number of your messages, I'll read them quickly and then open the phone lines for you to call in. But before I do that, it's time to turn to the network that gives you more data for less. Just dial star 700 hash to enjoy too much data on Vodafone. Getting too much data on your bundles on Vodafone is like asking for one thing and getting so much more. On Vodafone, we don't just talk about giving you more for less. We actually do. For only 10 Ghana cedis, you get 1.5 gigabytes of data valid for 15 days. For 20, you get double value of 4 GB data valid for a month. And for 50, you get a whopping 10 GB data valid for a month. But that's not all. Even when your data bundle runs out, you still get to use WhatsApp, Facebook, and Instagram for free. That's the magic of star 700 hash. So what are you waiting for? Dial star 700 hash now so you can browse and chill on Vodafone. Today's agenda is brought to you by Societe Generale, SG Ghana, the future is you, and Malak2 anti-malaria drug from Ernest Chemist, providing quality and affordable medicine. So Nee from Tema had this question before we went on the break, Dr. Kaba, about wearing nose masks. Should you think that we should have a nationwide directive that people should wear nose masks?
Need thanks for the question. I think is a good question to educate everyone on the mask. And the answer to you directly is that if we could get everyone to wear face masks, we will be the happiest health staff, because we know that using face masks is very, very welcoming and very good. So, however, it's availability. And that is why the government is trying to help produce locally the face masks. And once we get it, I would encourage everyone to wear it. But however, let's also understand that face mask doesn't replace the other issues of hand washing, social distancing. Face mask just complements them. So because you are wearing a face mask, you stop washing your hands frequently as possible, or you stop keeping the social or physical distance we're talking of. Using hand sanitizers, they are very, very important. Each actions complement the other. So
I've gotten questions about these cloth face masks, these designer cloth face masks, and some have raised questions that they are not as effective as your clinical issue. Is that true? Well, in fact, Portia from Akusia has that question.
Every country had to deal with it that way anyway. When the situation got worse in China, Italy, Germany, Korea, they all came out producing their local face masks, and it's better than nothing. You need it. So I would encourage you that what we have, let's make good use of it. And as I said, the face mask alone is not the solution. It helps to mitigate the transmission, but you complement it with hand washing, you complement it with social distance, because if you don't have the face mask on and you cough, it goes far or further than if you have the face mask on. So it's something very good.
But shouldn't we be regulating the way they are manufactured, so that they are manufactured in a way that is going to keep out the virus as well as everything?
Absolutely. Quality control is very necessary in every aspect of human life. And but one thing we should also always understand is that you can't get something right from day one. You got to start from somewhere and keep improving. And I'm very sure that even those producing it, they themselves are finding ways and means of reevaluating what they are doing and improving upon whatever they are doing. So I think it's something very good to do, but we need to do with what we have for now and keep improving.
So can they keep out viruses, these designer nose masks?
Yeah. You see, there is very little we know about the strength of transmission. But we also know that the virus is extremely aggressive. But we know that it's out of the droplets. So once you have the face mask on, it reduces the amount of, normally as we talk, a lot of saliva comes out of our mouth. You might not be seeing it. But the face mask help to reduce that amount of saliva coming out of your mouth, that amount of air coming out of your mouth, that impulse of going far, like if we keep that distance of, let's say, 2 feet, right, away from the person, then the face mask helps it to even reduce it to get into you. So it's absolutely necessary that we use it.
I'll open the phone lines at this point, 0302-216-541, 0302-216-541. Hello, kindly ask your guest how long it takes for the results to be released after they are tested. That's like right down your alley. Yeah. How long does it take for the results?
All right, so we try to make it in 2 days. But however, we need to explain certain things to the public. I am actually coordinating the laboratory testing, but I'm not in charge of the laboratories. I think I got to make this very clear. Now, what we've realized is that when we started this business and we were doing the testing on few people, it was easier to come out with the test quickly.
Okay.
But as we went into the mass or massive testing, where you have 5,000, 20,000, 30-something thousand, then it starts to slow down the process because we had very few centers. At the beginning, we had Noguchi, and they were working day and night. As a matter of fact, I actually sent my heartfelt congratulations to them. They were working day and night to be able to turn out the results. Then we had KCCR. They were doing the same thing day and night. And now we have we've brought many other people on board, like the Kolebu National Public Health Reference Lab that is also now testing, the Veterinary Services Lab that is also testing. We are bringing in CSIR that will also be running the test, and then we trying to expand to Volta region. The northern region. We are even trying to get machines that we can deploy for all the regions to be able to test, and then we don't have to bring samples all the way from Paga to Kumasi or to Accra to test. We don't need to bring samples all the way from Elubu to Accra for testing. We're working very hard to make sure that we decentralize the process. But let me say it this way, because the testing is a PCR test, and it takes a long time to roll it out. And so people should exercise a little bit of patience. We know the psychological... I know when I did my test, I decided I should go through the normal drill. Because you got to feel like how the people feel when they do the test. Then you appreciate when they make comments. So you get home and you sleep in and... you worry whether it's coming out positive, it's coming out negative, you get what I mean? So
right.
I've gone through it. But so I want to plead with our listeners that because of the numbers that we are testing now, it goes beyond the 48 hours.
But how many test centers do we have now?
So as I just explained to you, we have Noguchi, we have KCCR, we have the VET, we have the Kolobu Reference Lab, we have CSIR. Very soon, Volta region will be coming on board. Tamale will be coming on board. Kintampo will be coming on board. Navrongo Research Center will be coming on board. We are working towards the equipment and tests to see if the results will come out as accurate as we want.
So
and
that's five centers now and 4 in the pipeline.
If we do that, we're also looking at we have some machines in the country that we have over 136 sites for now, and we're trying to get, and that is what we've been doing for the last 48 hours, trying to develop the national response laboratory strategy to deploy all these centers with the things that we need. I must be very open to let you know that some of the things that we need to bring them into the country to complement, to fix those machines to work. Now, all the countries are locked down. Something that could take you 2 hours to get or 1 week to get, now you got to wait for like 1 month because they are locked down. The workers are not producing. So these are some of the things that are also influencing this issue of decentralizing the testing. I would have wished that we decentralize it immediately and for every region to be able to conduct its own test. I was in Noguchi 2 days ago in a meeting, and there was a company, I think it's Pharmacist, that donated a mobile PCR testing machine to Noguchi. And we are working hard to get more of those that you can carry along anywhere and you just do the test. But whatever you get, you need to test it and make sure that it can give you the results that you really want, not false positives.
Right, Doc. Johnson is on the line from Hacho. Good morning, Johnson. Good morning, Johnson. Do I have Johnson from Hacho?
Hello.
Right, yes. Johnson, you can ask your question.
Okay. I'm Captain and I'm a
It seems like Johnson is finding it difficult to hear us. Ajman Joseph is from Tema Community 9. Good morning, Ajman Joseph.
Good morning, because I hope you're doing well.
Blessed. Let's hear your question.
In fact, I may need some credit from you because you kept me long on the line.
Merci. Let's hear you now.
And I want to ask your guest. I believe when they started quarantining people, when they were entering, they were able to gather some data, knowing the positive, negative, those they are suspecting that they have some, they quarantine them, and also the test, the contact tracing. So for now, are we not gotten to the place that we've able to gotten those people who have contacted those people who were having some, to the extent that we know those people having some, those people that we suspect they have or they might have, so we are quarantining them, and those people who have been contacted. Because if your doctor is saying that community spread, as it keeps on increasing, then it looks as if it is coming from community spread. Are you able to gather people that we suspect they will get some?
Okay. So you want to know if we are able to tell those who we would suspect would have this disease?
Yeah, because
if
you say community spread, are people spreading it? And even the partial lockdown. Daniel, if I'm to stay home and my wife will go to the bank and work, and somebody who is not an essential worker will go to the bank, and my wife gets the sickness from the person, is she not getting the sickness to the house?
Okay. Joe, thanks very much for calling. George O'Kine is on the line from Mile 7. George.
Yeah, good morning.
Hi, George, let's hear your question.
Good. My question is, why is all our medical people, or why are all the medical people talking about lockdown? Have they not considered the fact that currency can transmit the virus better than human movement? Currency. You see, anytime I have money in my hand and I have it, if I give it to the dance and you give it to any water seller, she will have it. She will give it to anybody who is buying water, and that moves faster than lockdown. Human beings don't move, the virus doesn't move. But what if you also you have 50 people in the house? Okay, and you lock them down. 50 people in the house is more than 20 people at the ceremony. Why are they narrowing themselves to this lockdown? The gentleman just said a complementary setup, what they call it. So I think they should broaden the scope and not narrow the whole thing to just lockdown.
George, thanks so much for calling us. Ebo is on the line from Spintex. Good morning, Ebo.
Good morning, John.
Yes, let's hear it.
Let me commend you guys. You have not given your platform for politicians to override on you. I like that aspect. God bless you.
Bless you too.
And then my first thing is, those who are being arrested, are they going to be put in prison or in the cells? That's my first question. And then the commercial drivers in the nation must wash their car frequently and also spray inside and outside. And then I also need the sanitation ministry number. And then one thing that can help Ghana to prosper is we should have one policy to prosper as Africa. Amen.
Amen. Thank you very much for calling. That was Ebo from Spain Text. Nana Mwako is on the line from Aoshi. Good morning, Nana.
Yeah, good morning, Dan.
Yep.
How are you?
Blessed. How are you?
I'm great. Before the lockdown, we saw on TV when you covered the Ministry of Information forum affair. We saw that on the TV that we will come to your home and get you tested. We saw it in black and white. We're in the third week. I'm at Awoshi. I've not seen a single nurse in this area going from house to house to test. So we've been in the house for three weeks, almost 3 weeks now. No testing. I don't know whether the testing is going on somewhere in Accra.
Okay. Ebo, we'll get that answer to. Let's start with Ebo, with Nana Omwako, pardon me, and Nana Omwako's question. He's saying that he's at Awoshi. He has not seen anyone come to his house to test in this enhanced surveillance. Dr. Haba.
Yeah. So thank you so very much to all those who are asking questions, because I get happy when citizens are empowered to have interest in this kind of thing, because as I said, the best way to fight this is getting the citizens empowered so they can lead the way, the community surveillance. There's no better surveillance than the community people, and this shows that we have a lot of interest in getting over all this. I have interest for us to get over it, because even some of us, when we get home, we have to stay outside for a long period of time, disinfect ourselves before we can even join our families. Sometimes we don't. There are things that you can't even be saying here, you know. So the health staff are actually putting their best. Now, let me try to address that. You see, although we are doing enhanced surveillance and we are doing contact tracing, when we get a suspected case from your zone that is positive, then we get the whole zone tested. So it is understanding that we've not been at your place yet, but should we have any positive person around your place, we will surely comb the whole community around that place. Okay. And again, as we keep moving, as you know, Ghana, we don't have all the test kits on earth, because no country has all it takes to do extremely massive testing. You still have to stage them, and you still have to prioritize areas. So we look at areas that we have gotten positive cases from, and we start from there, so that they don't keep spreading. And that could explain why we are not yet at your place.
Okay. Ajiman Joseph in Community 9 had a similar question. He says that by now, shouldn't we have been able to identify all the contacts and quarantine all of them, so that the rest of us can go about our lives?
Mr. Ajiman, thanks for the question. You know, as I said, 88% of our they are just like you and I, talking, no cough, no fever, no nothing. They are in the early stage. We could even say that we are in the early stages of the disease. So we will have to keep tracking and tracing. That's the difficulty here. And so that is why we want the community to come out. If you suspect anyone, somebody who has traveled or has been in contact with someone who has recently traveled and is also having cough and all the symptoms that we know, sore throat and fever, then you let us know. Then we will come there. Because most of the cases, they don't show any sign, and so it becomes a little bit difficult. But we'll keep tracking, keep tracing. And we all want to go back to work. I would want everything to resume as early as possible. We have families, we have brothers and sisters who live on day to day, and we need to get the economy running. So we are all together in this.
Right. There was a question about people who flout the social distancing, the stay-at-home policies, and whether or not these people should be arrested.
Absolutely. I will just be very straightforward. If you actually, in my previous interviews, I said this whole disease can be fought and won if we do some three things. One was the solidarity, where people don't purchase everything that is available because they have the financial muscle, but we all have to manage. The second thing I spoke of had to do with the health measures. Wash your hands, this, that. But the most important one is discipline. Discipline. When you follow the rules, the established rules. Look, South Korea had 10,024 cases There's only 208. Because they've been disciplined. They followed every step that the government prescribed. Two, the community was empowered to do that community vigilance and surveillance. Hong Kong did the same thing. Japan did the same thing. Singapore did the same thing. People who have been disciplined and they've adhered to the rules of the game actually got it better.
What's our model? Given what you're saying, what's our model?
Dan, I would say that if you come out without any reason, why not? You should be arrested. Because you got to set that example for people to understand that this is serious business. This is not business as usual. You know, I was watching, and you see, for every one case that we get, right, out there, if you remember, we have the case 31 of South Korea. Which ended up just one case. By the way, the whole thing started with just one human being somewhere. And now the whole world is in trouble. So just one case can put the whole Ghana into trouble. Why do we have to accept that from you?
Right. Kofi is on the line from Adenta. Good morning, Kofi.
Good morning. How are you?
I am blessed, Kofi. What's your question?
I actually had a little issue with this contact tracing. A guest from the UK. The person came in and left. I was there after a week. They called me whether the person is around. And I said the person has left back to the UK. And it was okay. And they cut the line. The second day, another person called. But I was thinking, one, everybody who has traveled in, they should have even bothered to ask me, where are you? Let's come and see you and find out whether if even me, myself, I'm okay. Because it could have been that I was still in the period that the disease hasn't come up. So I think that if those doing the contact tracing are to ensure that things are done well, these things must be put. Once you have come into contact, whether you are showing signs or not, at least they should have approached me, come, checked on me, whether if I was good. It could have been the period that the doctor was saying I wasn't showing symptoms, and I was still going around. So they do try and educate those doing the contact tracing to add more, a bit of effort to identify people.
Kofi, thank you so much for calling. Zenolia is on the line from Accra. Good morning, Zenolia.
Yes, good morning, sir.
Hello? Yes, you're on it.
Yes, yes. Thank you very much for the good work you are doing. Yes, please, I want to ask this question now. Please, I want to know how is the test done? Because for what I know, we were told not to just walk to any hospital and then just say you are coming to have your test done. My husband is a waiter. He's working at the airport at the moment. And he was asked to come to the airport clinic and have the test done. He has been there for about 2 times. And then anytime he goes there, they will just tell him that they have stopped. At times they will tell him that they are segregating the place, so he should go and come. And as at now, that he has not done it. And he is going to work and he is coming to meet his children and then his wife at home. Don't you think he's putting the family at stake?
Zenolia, thank you very much for calling. We'll put that to Dr. Kaba. Kofi is on the line from Tema. Good morning, Kofi.
Dan?
Hi, let's hear you.
And going to the doctor. I actually took the test. I took it. And I regret taking it. It is highly psychological. And listening to the doctor this morning, I have some questions. So let me just go ahead with my questions. Number one, why didn't they bring along a psychologist to talk to people taking the tests? I didn't see any psychologists. The people taking the test asked questions. They themselves were not tested. How sure are we that they themselves are not carrying the virus? Why don't they test those people who are coming to do the tests? Now, how do you get your results? If you are negative, will you be contacted? Or is it only positive cases that are going to be contacted? If that is the case, those who are negative, won't they live with a psychological trauma? As the doctor himself has alluded to the fact that he himself took the test. It took days for the test to be, the results to be confirmed to him, and he was under some trauma himself. I was under the impression why I took the test, I was under the impression that they might have probably come with a van and do the test instantly so that we see the results instantly.
Okay.
Why didn't they do that? And another important question, why is it that you take the test, it takes weeks for the test results to come? If the person is positive, won't the person have spread it? Because the person who takes the test moves around freely.
Kofi, thanks for calling with this question. David from Kumasi is my next caller. Then Doc will answer the questions. Good morning, David.
Good morning, Dan. Trust you all.
I am blessed. Yourself?
I'm good, bro. Dan, I have a few questions. Number one, we still have some lengthy hospitals and some clinics. You go there and you see these workers not even wearing nose mask, not even gloves, especially even those taking vital stats. It's not their fault, they don't have. Then what are we doing about it? Because day in, day out, trust me, people will go to these places with suspected cases of malaria and other things. In case people are carrying the virus, now these professionals get infected and then it moves from there. Careful, this thing is likely to overwhelm us, depending on how we handle it. Sometimes my humble plea to those doing these donations, I just wish they can also prioritize these small clinics and then other hospitals as well, because those people there are likely to join our numbers, and then it become something that we can't even handle, because even almighty US are struggling to handle this issue. Then that is one side. But then I have one major issue with this issue. Since the lockdown, I tried going to town last 2 days in Kumasi. Seriously, what I was going to do was very important. Other than that, I wouldn't have gone at all. But if I tell you the strict measures that I went through, the procedure, questions I went through before I was able to get to Kumasi, trust me, it was. I'm planning not to go again, because even coming back home was hell of time.
David, thanks for calling, but I'm very sorry I had to step in at that point. Please forgive me, David. That news conference at the Ministry of Information has started. It's currently ongoing, and the Minister of Information is currently addressing the public. So let's go to him. But let me say thank you to Dr. Samuel Kaba before we go on. Thanks, Dr. Kaba, for coming. Really cleared up a number of the issues for us. And we are hoping to have this conversation again very shortly, so that we can update ourselves on this virus and this disease. Let's go to the Ministry of Information now.
Working on a campaign to ensure that young people also protect themselves